Okay, so the next one we're going to look at is the quad. So coming over the roller forward, so you're going to move back down over the roller and forward. So you're going to go from the hip down to the knee. You can come onto one quad if you need more pressure, so putting one leg up so that it's not touching the roller. Find that tender point, hold it there, 7 out of 10, 60 to 90 seconds, and do 2 to 3 points on that quad. So another one you can do to get through the front of the hip is coming forward, and you're on a 45-degree angle to the roller. So it's up towards the top of the quad, and you can roll through the front of the quad again there, the top, up to that pelvic bone, just that point that sticks out the front there. And then you can come back more onto TFL, into glutes, just play with those areas and find those tender points. The real quality we get from rolling is holding on a particular point for that period of time, that 60 to 90 seconds, as opposed to rolling up and down the muscle or the tissue. We're getting a really good fascial opening with that length of time.